Madam Deputy Speaker, before entering Parliament, I was a trustee of a veterinary mental health charity. And I've had to clarify before that this is not a mental health charity for animals with mental health issues, but it's called Vet Life, and it is a charity that cares for the mental health of the veterinary profession. And I became a trustee of this charity because my really close friend, Sarah, at the age of just 31, and she had a whole life and career ahead of her, took her own life. And so I took her place as a trustee. And the reason I think it's, losing her actually, getting the news that I had lost her is one of the most painful experiences of my life. And I know that there'll be many other members in here today who will have suffered very similar experiences with their friends and their loved ones. And I speak about Sarah because while we're in this place, we often discuss mental health issues in the terms of statistics, and rightly so. We talk about waiting times, workforce shortages, the economic impact, but we must never forget that these are individual lives behind these numbers, and nearly every person in this country is affected in some way. Now that might be through their own struggles, or maybe those of a loved one, or through grief after someone they care about has lost their battle with depression. But to briefly return to statistics, the profession I come from, veterinary medicine, has a suicide rate of 4 times the national average. It's a very small profession, everyone knows everyone, and so everyone has lost a friend or a colleague to suicide. And the reason I share this is not just for awareness, but it reminds us that there are certain groups that are of a much higher risk, and they are more vulnerable than others, and we could and we should be doing much more to identify and support them.
Would he give way?
I'll happily give way.
I thank my honourable friend for giving way. He will know as a veterinary that farmers also suffer with significant mental health issues, and my constituents in Glastonbury and Somerton under immense pressure following the family farm tax and the sudden closure of the SFI. Alongside this, they work extremely long hours, and unpredictability of farm work means that it's more difficult for them to be able to access mental health support and doctor's appointments. So does my honourable friend agree with me that we should introduce regular mental health MOT checks at key points in people's lives when they're most vulnerable to mental ill health, particularly to those in rural areas where there are barriers to accessing support?
I thank my honourable friend for that intervention, and you won't be surprised that I do agree with you, as you may as well have read the next bit of my speech. You're completely right. Farmers, those working within agriculture, military veterans and their families, mothers in the first year after childbirth, people living in poverty, LGBTQ+ community. These are just a few of the groups that we know are at heightened risk. Now, we already take a proactive approach when it comes to physical health. We have targeted cancer screenings for at-risk demographics, and we should be doing the same for mental health. And that is why, as my honourable friend for Somerton and Frome has just Glastonbury, change constituency names, boundaries. We've long called for properly resourced community mental health hubs to reach people before they reach crisis point. And we're also calling for regular mental health checkups at key life stages, such as when someone's just given birth or just been discharged from the army. I will happily give way.
I'm grateful to my honourable friend for giving way, and he's outlining the treatment options for patients. And new medicines are also incredibly important, and there is groundbreaking research happening at the Warnford Hospital in Oxfordshire, which is also a mental health hospital in desperate need of investment. The two go hand in hand and is in desperate need of investment. Would he agree with me that the government should get behind the Warnford and invest in it?
Changes.
I will agree with my honourable friend, and thank you for your intervention. These mental health MOTs could really help catch at-risk people early and start treating them before the problems develop further. Now, I'm sure, like all other members here, mental health issues is probably one of the top issues in our inboxes, for our emails, our correspondence. We receive emails from desperate parents, young people left on waiting lists for years throughout their schooling, and adults falling between the cracks of an overstretched system. And we should probably acknowledge that these are not anomalies. They're symptoms of a system that is under immense strain. So this long-awaited mental health bill is a very welcome step. It can't be the only step, because at the heart of our approach must be a simple principle, and that is prevention is better than cure.
Am I right to give way?
I will happily give way.
I absolutely support the idea we need to invest in prevention, 100% behind that. But I also have spoken to many constituents who have issues with that emergency health care. And Ed, one of my constituents who sadly took his own life, went into A&E with a psychotic episode, was left simply with a phone number, no assessment, and hours later was lost. So I think we also need to make sure we get that emergency treatment for those who need it on the spot, as well as, of course, investing in that prevention. And would my honourable friend agree with me on that principle?
Danny.
I totally agree, and we will come on to the care of people once they've been discharged from an acute mental health episode, because it is a hugely emotive and problematic situation. So we need a comprehensive mental health strategy, one that sees mental health not just as a clinical issue, but as the Secretary of State did discuss, it's something that needs to run through housing, education, employment and justice. Because while good clinical services are absolutely vital, we cannot medicate or refer our way out of a mental health crisis. Because many mental health issues are often rooted in very deeper challenges, things like poverty, housing, insecurity, loneliness, debt, trauma. These are not medical problems, but they put people at huge risk of developing mental health issues. And if we're serious about prevention, we must tackle these root causes head on. Now, this bill focuses very much on the rights and treatment of people once they are admitted to mental health units, which is essential. But what is just as important, as my honourable friend just highlighted, is what happens when they're discharged and what support they get in the community to prevent a relapse. Now, in Winchester, we've seen a brilliant initiative between local NHS mental health teams and the Citizens' Advice, where teams from the Citizens' Advice are in a mental health unit called Melbury Lodge, and they help mental health patients with all their life admin, the bills, the correspondence, so they're not discharged back into the community and come home to a load of outstanding credit card bills and demands to repay their PIP payments, for example. And what is remarkable is that every pound spent on this initiative saves £14.08 on cost avoidance for the NHS. It's through shorter inpatient stays, fewer readmissions, better engagement with services once they're discharged, reduced medication use, and it's a win-win for staff and the patients and the taxpayer. But this is a pilot project, and there's no funding secured for it to continue, despite the proven cost-saving benefits. So we'd urge the government to look seriously at rolling initiatives like this out nationwide. Now, my honourable friend, the member for Dorking and Hawley, has been passionately campaigning since entering this House to ensure that families have a greater input into medical decisions when there are questions over the mental capacity of vulnerable patients. And I'll invite my honourable friend to make an intervention.
That's right. Well, I thank my honourable friend. And as my honourable friend knows, in my maiden speech to Parliament 8 months ago, I pledged that Fiona Lascaris would succeed in changing the law that prevented her saving the life of her autistic son, Christopher, from murder. Fiona is here today. Despite pleading for years, Fiona was never able to obtain a mental capacity assessment for her son. And as we heard from the Secretary of State, the government is now seriously looking at an amendment that would both honour Christopher's legacy and save lives. Does my honourable friend support this amendment?
Danny Chambers.
I thank my honourable friend for that moving intervention, and our condolences to the gallery. And we do appreciate the Secretary of State for seriously considering how we can have an amendment that may help save lives. So, early intervention, it can't just be a slogan. It has to be the foundation of a functional system. Now, last week, I sat around a campfire with the amazing team at the Winchester Youth Counselling Services. And this is a charity that has a nature therapy program and these 11 to 16-year-olds come and they can go camping, walk and talk therapies, do bushcraft, outdoor cooking. And while we're toasting our marshmallows, they were talking about the free confidential mental health support that they offer, providing services such as one-to-one counselling and a weekly wellbeing walk-in session. Now, by immersing young people in nature, this programme helps reduce stress and anxiety, fosters emotional well-being and resilience. But crucially, these services are accessible without the need for a doctor's referral or diagnosis. Young people can self-refer, ensuring that support is available promptly when it's needed most. And Madam Deputy Speaker, that's why Liberal Democrats have been calling for mental health hubs for young people in every community. And I know we share the government's campaigning for a mental health professional in every primary and secondary school, not just an occasional visit or a pilot scheme, but a permanent funded presence. I'll happily give way.
I thank my honourable friend for giving way, and just to follow up on his point about the importance of mental health hubs. In West Dorset, the only CAMHS centre is in Dorchester. For many people in West Dorset, especially young people, that's an over 30-mile round trip to access services. And in rural Britain, where transport links, if you're lucky, exist, if otherwise they are limited, that makes accessing services nearly impossible, which is what makes hubs so important.
I totally recognise the importance of that intervention. We also need a system that is much easier to navigate. A psychiatrist came to see me in my office in Winchester, and his son had been referred to CAMHS. And despite he and his wife working within the medical profession, they said they really struggled to access the help that they needed. And he said, if we can't navigate the system, what chance does anyone else have? And that is one reason the Liberal Democrats were calling for a mental health commissioner. That's someone to champion families, cut through bureaucracy, and help people get the support they need before things get worse. Now, the system needs to be simplified, both for the parents and families who are trying to access service, but also for the system itself to be able to actually function. For years, Liberal Democrats have campaigned for mental health to be treated equally with physical health, and we welcome this commitment to parity in the King's Speech. It must be backed by action, and the Darcy report showed that the NHS workload, as the Secretary of State acknowledged, counts for around 20% of the NHS case burden, and yet it receives just under 10% of the funding. And for this reason, we're wanting to ensure that the mental health invested standard is maintained and strengthened and not quietly scrapped or watered down. The Secretary of State also did highlight the scale of this challenge. Around 1 million people are on waiting lists for mental health services, but importantly 340,000 children are on mental health waiting lists, and some of them waiting for an average of over 15 months for care, which is a huge chunk of their educational time and their personal development. See, this is not a crisis that is waiting to happen. It's a crisis that is already here. And Madam Deputy Speaker, some people do ask, in this economic climate, how can we afford to invest in mental health? But the real question is, how can we afford not to? Because we are already paying the price in lost productivity, emergency call-outs, A&E admissions, and most tragically of all, in lives cut short. We must spend to save. And as the member for Bermondsey discussed, spending time with the police, I've done the same thing, a fascinating and very informative exercise, and I'd encourage everyone to go on patrol with their police. And in Winchester, the police say they spend up to 40% of the time responding to mental health-related incidents. We know many patients turn up to A&E in a mental health crisis, many of them already on a mental health waiting list. And I heard that in the Winchester's A&E, the average amount of time someone spends in a mental health crisis in A&E, often needing individual supervision, is 18 hours. This is not sustainable because we're using the most expensive parts of our health system to do the work that should be happening earlier. And it would be more cost-effective for the taxpayer and a better outcome for the patients. So finally, I want to pay tribute to all those on the front line, the nurses, the counsellors, the psychiatrists, the doctors, therapists, support staff and the charities who prop a system that should be supporting them. And we're looking very much forward to working constructively with the government to improve this mental health bill, and we do support this. We'll keep pushing until we live in a country where mental health gets the same attention and care as physical health.